Good morning, friends. Today this is the third part of your immunology. Yesterday we have been started with that, and in the first part we saw what is immunology, and in the second part we saw the different types of cells participating in the immunology, and today we'll see what are the drugs which are used for as immunosuppressants. And actually we gave the title as immunosuppressants, and in order to know the immunosuppressants we started what is immunity. And yesterday we were discussing about immunosuppressants, and here I gave you once again that I am giving you the heading over here. These are called as immunosuppressants. Okay. So the immunosuppressants are the pharmacological agents which are used to suppress your immunology or immune, that is nothing but the immunoglobulins, the power of T cells, the power of B cells, so that they may not be participated in the immunity. And we know that these suppressants are particularly used in organ transplantations. In organ transplantations we know that the organ is being replaced from the old one to the new one. And so when in order to set to our body these organ transplantations, the organ has to be detected by the body and should not think that it is a foreign body came from outside. So in order to get into that situation, we need to give some immunosuppressants so that the body will adapt, the body will adopt as itself to the organ what is being transplanted, particularly the liver, the kidneys and the heart. So today we'll see what are the different. Yesterday I just want to give a recap of yesterday's class. And yesterday I was discussing in that part about two cells over here which are participating as immunosuppressants, and I gave you some numbers over there where the particular drugs are acting at that spot, and I asked you all to make such points over there so that the numbers will be indicated over there, and that particular number will indicate you that where the drug is being acted and what is the mechanism of action. And here I indicate yesterday's class we indicated about 5 numbers over there, and these 5 numbers will be represented over here. And at the first spot what we saw is it has to be the macrophages, that means the identifier immune cells which are being fighting with the antigens which came from outside the foreign bodies, whether it is in the respiratory system or it is in your circulatory system. Whatever it is, it has been recognized by some of the macrophages, and as we know that the macrophages are collecting the foreign particles and it is being phagocytized, that is called as autolysis, and though after that phagocytosis the foreign body is engulfed inside and that particular cell is formed into APC, and as I said yesterday it is called as antigen presenting complex cell. And here it got some MHC complex onto the cellular parts of the cellular membranes, and onto the other side you have T cell, and that T cell is a cell which consists of different components and different mechanism inside once the foreign pain is being detected. And once this MHC is being collected or reionized onto the T cell membranes, particularly the protein particles or the protein which are present onto the T cell, they are called as CD4 and CD3, and in between you have the T cell receptor. So you have the different 3 points which has been collected onto it, and they get attached onto it, and it gets some conformational changes, and the foreign particle will enter into your T cell. Once it enters into your T cell, it is being collected by the protein body called as calcineurin. And as I said yesterday, the calmodin is something which has been related to the calcium ions, where it is attached, and so that it gets your depolarization and the hyperpolarization for the firing of your neurons. And this is a antigen particle, it's a protein particle, protein gened particle, which is called as calcineurin. And I said yesterday this calcineurin is nothing but the complex of calcium and nothing but calmodin. Calmodin anti-membrane cells or calmodin cell. And as I said before, it is done for the proper differentiations of calcium and Calcium is used for the hyperpolarization and the depolarization of the particles, and CAM are used, and both of them are converting itself. Actually calcium is not converted, but the calcium is converting itself into PKC, and as we know that the PKC is called as protein kinase C, and this protein kinase C is used for the production of anti-inflammatory bodies, what are called as actually not anti-inflammatory bodies, it is inflammatory bodies. It is inflammatory bodies what are called as IL-1, IL-2, cytokines and TNF-alpha. And these are all different types of inflammatory organs symptomized by the disease. And as I said, and these also not only converting itself into CAM, that is called as calmodulin presenting cell, it is also converting itself into nuclear factor activating transaminase, which is acting onto the cytokine gene. We know that the cytokine gene is something presenting the cytokines outside. So once it is been developed itself into NF-80 and it is been developed into cytogenes, and the cytogenes are converting directly itself into inflammatory mediators. So this is just a recap of yesterday's class. Now today we will see different types of drugs, or different categories of drugs, or different classifications of the drugs which are used as a immunosuppressants. And here I gave you the classification. In the first classification, it is represented by one called as calcineurin inhibitors. What we know this a calcineurin is nothing but the protein gene which is present here, and what it is called as inhibitors. Inhibitors are something blocking, reducing or inhibiting that particular gene which is present. And so the classification itself is indicating you that it is the inhibitor of a calcineurin. So this type of classification are acting at this spot. So we can come into action. This is called as calcineurin inhibitors. So at this spot, these calcineurins are acting onto the first classification. And next we have the second part called as anti-proliferatory drugs. These anti-proliferatory drugs are also called as cytotoxic drugs. Actually, this type of classification will be reading in anti-cancer drugs, where the cytotoxicity will be reduced by these drugs. And also we know that the cancer is some of the diseases which is caused by the proliferation of the cells. And in order to reduce your proliferation of the cells, anti-proliferative drugs are used there. And so same category can be used over here also. So they are called as anti-proliferative drugs, nothing but they are called as cytotoxic drugs. And these cytotoxic drugs are something, as we know in the classifications of anti-cancer, and the best drugs are azothioprine, methotrexate, MTX stands for methotrexate, chlorambucil, cyclophosphamide, and mycophenolate mofetil, and which is called as MMF. And once again I am repeating you the drugs which are present, anti-proliferative drugs, and these drugs are also called as cytotoxic drugs, which are used as an anti-cancer drugs. And the same classification is being drawn here, got it here, so that it is inhibiting your proliferation of the cells, inhibiting the differentiation of the cells, inhibiting the production of plasma cells, inhibiting the production of memory cells, inhibiting the formation of natural killer cells. Yesterday I gave you one diagram over here, how it is been differentiated between the cytotoxic drugs and the cytotoxic cells and also the plasma cells, particularly in the classification of T cells. If you just may not be getting to the recap, you can go and watch the video what I did in the first part. And this is called as anti-proliferative drugs, which are used as inhibitors of proliferation of the drugs, and they are called as azothioprine, methotrexate, chlorambucil, cyclophosphamide, mycophenolate, mofetil, and in brief it is called as MMF. And out of these I can tell you that this is called as tacrolimus, and the best drugs in the calcineurin inhibitors are cyclosporin and also tacrolimus. And anti-proliferative drugs are azothioprine, methotrexate, chlorambucil, cyclophosphamide, and mycophenolate mofetil. Nothing but it is called as MMF. And out of this calcineurin inhibitors, this is much potent drug which are being used mostly, and has been made it into a block-like structure, which is indicating you the potentness of that classification. And here the cyclophosphamide and chlorambucil are much potent drugs over here. And after these two, the azothioprine will come into the space. So I am giving you the potent drugs in that particular classification into the block-like structures, which is indicating you that they are potent. So once they ask you any question regarding these chlorambucil, or it is asking for the cyclophosphamide, or whether asking about the azothioprine, you need to indicate the same mechanism of action. Why? Because they are belonging to the same classification of the drugs. And here in the first one also, as I tell you, it is calcineurin inhibitors, where two drugs are most famous, what is called cyclosporin and tacrolimus, and out of which this cyclosporin will be studied in the further class. And so as I said before, once the drug has been asked whether it is tacrolimus or the cyclosporin, you need to indicate the same mechanism of action. Why? Because it belongs to the same category of classification. And now we'll come to the third classification, that is called as glucocorticoids. Actually, this has not been much to be told over here, but we can indicate all the drugs which are present over here, what is called as prednisolone. And this category will be always run in your angiotensin drugs, where the glucocorticoid is one of your classifications. And also in your histamines, you will be reading about these glucocorticoids, prednisolone and mineralocorticoids. So these are different types of classifications which are being run in your antihistamines, and also relating to angiotensin drugs or renin-angiotensin, where these drugs can be used of. Why? Because glucocorticoids and mineralocorticoids are being produced by the adrenal medulla of your kidneys. And also the fourth classification, which consists of antibodies. The antibodies, the body itself is indicating you that it is inhibiting some of your antibodies. So this called as bodies, or called as AB also. Why? Because they are acting against your antibodies. And because we need to drop out on your antibodies which are secreted by which are synthesized by the body. So we cannot make the antibodies more and more production, as we know that the antibodies will be always produced by the B cells, which are used for the synthesis of from the bursae, and from the B cells they are producing different type of antibodies, and these antibodies will come and sit onto the pathogens, where then they are called as epitopes. I have already discussed about this in the previous sections. And now this antibodies is also one of the classifications, what is called as muronobacid-3 anti-thymocyte globulin, nothing but ATG, and it is also called as Rho-D immunoglobulin. And once again I want to repeat the same thing, it is called as glucocorticoids, called as prednisolone, and also antibodies. And these antibodies, we know that they are the antibody synthesized immune synthesis particles for the fighting of against the antigens. And there may be muronobacid-3 anti-thymocyte globulin, Rho-D immunoglobulin, or nothing but IG. Immunoglobulin is represented as IG over here. So muronobacid-3 anti-thymocyte globulin and Rho-D IG. And here we know it is indicating you that anti-thymocyte, nothing but it is stopping the synthesis from the thymus gland. Cyte means cells. Thymo means, thymocyte means thymus cells. So what is acting against? It is acting against your anti means against your thymus cells, and so it is called as anti-thymocyte. We know that the T cells are produced from the thymus, which is nothing but the lymphatic system gland, and globulin is nothing but your immunoglobulin. And in the summary, we can call that particular product is called as ATG, and also the other one is called as Rho-D IG bodies. And out of this, and if according to the important questions regarding your question papers for the pharmacy, to attempt a B pharmacy papers, you can collect only 2 or 3 drugs. One is called as chlorambucil, azothioprine, cyclophosphamide and cyclosporin, and out of that muronabine is much more important, that I am categorizing into your potent drugs and blocking into the same category. So, and in brief, once again just we'll have a recap of all the classifications from the top, and we'll go to the mechanism of action. And here this is a mechanism of action giving you the classifications of your immunosuppressants. And here I wrote the spelling of immunosuppressants as wrong, I think. SUPPRES. Just let me present suppressant. immunosuppressants. Yeah, this is the correct spelling. I'm just correcting myself. English called as immunosuppressants. And this is the classifications I am giving you over here. The first classification is nothing but the calcineurin inhibitors. The second one is called as anti-proliferatory drugs. And the third one is called as glucocorticoids. And the third one is called as antibodies. And out of this calcineurin inhibitors, that is cyclosporin and tacrolimus. And anti-proliferative drugs are azothioprine, chlorambuzil and cyclophosphamide. And glucocorticoids is prednisolone, and the antibodies are much and more called as muronab and CD3. And out of this, this already will be discussing in the anti-cancer drugs. Whenever our topic goes to the anti-cancer, we'll just discuss over there. But out of which, according to the B-Pharmacy question papers and all the other question papers, and this is only one, the drug which can be asked from the classification of immunosuppressant. So let me focus only onto the cyclosporin, and now we'll discuss what is the mechanism of action of cyclosporin. And according to the picture what I gave you over here, we'll giving you the classification, will give you where it has been acting. I told you previously itself that it is acting onto the calcineurin protein gene, where it has been creating some two complexes, what is called as calcium and the cal, nothing but calmodin at presenting membrane cell. And so once these are acting onto the calcineurin inhibitors, it is indicating the same thing here, calcineurin inhibitors, that means it is inhibiting calcineurin. So what happens when these are doing the same classification? And let me present you into the aromatical presentation so that you can understand what it is. And I think at present you can understand what it is. And now I am starting with the cyclosporin over here, or we can call it as calcineurin inhibitors or cyclosporin. I'm keeping you this picture so that you can understand starting from there. Here I am representing you calcineurin inhibitors or cyclosporin. So how they'll ask you and frame your question is, write, define immunosuppressants, classify them and write the mechanism of action of cyclosporin. So we need to answer that question according to the question what is given in the question paper. And now as I told you, and just as it is the only potent drug which is in this classification, and let me represent in that form. So we can see that the calcineurin inhibitors or the cyclosporin are the drugs or the classification of the drugs which are acting. So we are representing here over as acting or acts on. So we are representing in the small word called as acts on. So we know that it is acting onto the protein gene calcineurin. So I am representing you over here just in an aromatically so that you can represent the mechanism of action is very easy. And actually representation of a pharmacology mechanism of action into the aromaticals will be very easy to understand and also very easy to represent in your question answer papers. Why? Because it gives you the summarized mechanism of action rather than giving you in a paragraphatical way. And now I am representing over here is a cyclosporin, and as I told you here, it is acting onto the calcineurin gene where the antigen has been collected on and it is absorbed into the T cell. And according to this, we can understand that it is inhibiting this particular part. And so only I wrote over here the cyclosporin is acting on your gene. What is that? It is called as calcineurin, and what it is doing. And now I am representing with another word over here called as blocks. So we know that in order to inhibit something, it has to block something. So here I am representing it in a small word what is called as blocks. And by this we can understand that it is blocking something. So what it is blocking? It is blocking the complex of calcium 2 plus and CAM. So this is the way how we need to represent. And after this, once again you give an aromat and tell what is happening after the blocking of that calcium cell. And in order to represent this, we need to understand here one more point over here, that in order to make it inhibition, this part, this is nothing but the cyclophilin part. It is one of the gene which is present into the T cells. It is called as cyclophilin. Cyclophilin. And this cyclosporin, once it is being absorbed into the body, it enters into the T cells and being attached to the gene called as cyclophilin. And the whole part will come and sit over here. So once it comes and sits onto the calcineurin, you can understand that there is no production for your calcium and CAM. Why? Because it has been blocked with another foreign substance, nothing but the drug here. So this is called as cyclosporin gene, cyclophilin gene, which is collected by the cyclosporin, and now we can represent that word over here. So what I told you here is the blocking of the complex of calcium and CAM, nothing but the calcineurin. So what it is doing, it is making the attachment, because it is having some attachment with or attachment of this drug called as cyclophilin protein plus the drug what is called cyclosporin. So these two are being combined, and the whole combined section will come and sit onto the calcineurin, and that calcineurin cannot be collected, cannot be so it's been seated over here. So the gap of the calcineurin has been filled with the drug, and so there is no, it is doing the blocking. That means the calcineurin gene protein is made not functioning, because some foreign substance is nothing but attachment of the drug is being done over there. And so once it is being inhibited and blocked with itself, the production of calcium and CAM has been not done, and so this has been attachment of that. And what happens? This is inhibiting. So what it is inhibiting? We need to write the word here, inhibits. What is it inhibiting? It is inhibiting CAM. And also it is inhibiting your Ca2 plus, nothing but the ions of calcium. And once it is inhibiting, you can understand that it is inhibiting PKC. We know that PKC is nothing but protein kinase C. And once this protein kinase C is being what it is doing, it is inhibiting your inflammatory factors called as IL-1, IL-2 and TNF alpha. So these are the inflammatory factors. So the whole mechanism of action is brought about with 4 steps over here. So this is a very easy mechanism of action representing in the pharmacology, and to also it make you the appreciation of the invigilator. Why? Because he has to not to need all the matter, but he can see the just the 4 points where it is acting, where it is working and what is inhibiting. Only the 3 points can be represented within 5 to 4 aromatical conditions. And this is a very easy part of pharmacology to represent itself. So once again I want to just repeat and you can understand what it is. Here the calcineurin is one of the protein gene or the gene particles which is being collected by the anti-representing cell. That means antigen presenting cell which is having antigen inside the body. It has been collected inside the T cell and it has been stimulating in your calcineurin. And once this calcineurin has been being stimulated, we know that it is being 2 differential components, what is called as calcium and CAM. And this calcium, we know that it is used in the hyperpolarization, nothing but the firing of the neurons or firing of the T cells, particularly over here. And also it is converting itself into PKC and the PKC is always telling you about the production of IL-1, IL-2 and TNF-alpha. Now in order to suppress yourself, that was the whole mechanism of action. But now we are doing against the mechanism of action. Why? Because we want the category has immunosuppressants. And these immunosuppressants, I told you, the first category is calcineurin inhibitors. And this calcineurin inhibitors is one of the most potent drug, and also the cyclosporin is the best and potent drug which is popularly used as an immunosuppressant. And as a representative here, we can understand that the only small point which is indicating you where it is acting. So it is, we have to write it as acts on, or we can write as acting on. We can do it the two ways. And so we can represent in the word as acts on. So where it is acting on the calcineurin gene or the protein. And this calcineurin is been acting by the, how it is acting by a drug. And this drug, it is blocking the complex of calcium and CAM. So what is the duty it is doing? When it is blocking, you can't synthesize your calcium and you can't synthesize your CAM. And how this production of attachment of blocking is done? This is done by an attachment of a cyclophilin gene which is present onto the T cell, where the drug which is given onto the an oral route, or whether it is your IV route, whatever the route is, the T cell will be collecting, and that the particular cyclosporin drug is attached to the cyclophilin gene, and that the whole complex, that means the whole block, will come and attach onto the calcineurin. And so once you see this is blocking or something, that means it is piercing something, it is striking your calcineurin with the drug. And once the drug has been taken inside, they cannot give you the complexes of, as I told you, indicated over here, it is blocking your complex of calcium and CAM, nothing but your calmodin. And also, sorry, not calmodin, it is calcineurin. And once this complex has been attached, it has to inhibit something. So what it is inhibiting? It is inhibiting the sources of CAM and also the sources of calcium. And once you can understand, when these two drugs are not being, the two components are not being done, the product, the next component or the next part, the PKC is not formed. So I have represented over here as aromatically over the small aroma called as showing down. It is showing you that it is inhibiting. So what it is inhibiting? It is inhibiting PKC, nothing but protein kinase C. And once this protein inhibiting kinase is doing, so what it is doing? It is one more step. Here I gave you, it is inhibiting your production of IL-1, IL-2 and TNF-alpha. That means the inflammatory factors are being inhibited. So once these are all inhibited, you can suggest that it is immunosuppressant. So the one what we want, that means what we want with the drug, it is immunosuppressant. So finally we got with the word called as immunosuppressant. Why? It is suppressing your inflammatory factors. How it is suppressing your inflammatory factors? It is inhibiting your PKC. How it is inhibiting? It is inhibiting your CAM and it is inhibiting your calcium. And also it is not only doing the, how it is doing this job? This job is done by the recognition of this particular complex of cyclophilin protein along with the cyclosporin, which is nothing but the drug. And after these two complexes are formed, the attachment of calcium is been blocked off, and this blocking of calcium and CAM is being done by the acts on the calcineurin gene. So it is represented in the form of an aromatically, so that the representation of mechanism of action is quite easy and to understand. So this is called as mechanism of action. And now we'll proceed to the other part, what is called pharmacology of cyclosporin. So we need to go for pharmacokinetics. So let me erase off the whole board so that the pharmacokinetics will be betterly understood. So in order to write the pharmacology of cyclosporin, we need to go for the next one. What this is actually called as PD, nothing but the pharmacodynamics, where it is acting on, what it is acting. And now we'll go to the next part, what is called PK. We know that PK stands for pharmacokinetics, and the pharmacokinetics consists of 4 different places. One is called absorption, the other one is called distribution, the other one is called excretion, and the other one is called metabolism. So now we'll see what it is absorbed. how it is absorbed. Particularly the immunosuppressants are always given to the person who has been going for the operation or going for the surgery of your transplantation. So it has to be given before 15 days. 15 days before the surgery. Before the surgery, so that the collapsing of all the immunosuppressants will be done and the patient will be ready for the organ transplantation. And particularly this is given through oral route. And after the immunosuppressants are being given and after the 15 days, the patient can be shifted to IV, but still the first absorption place is oral route. It has to be getting over route for the 15 days before the surgery. And we know that it has been distributed to your immune system, nothing but your T cells and B cells. Here you present here over here. This is distributed to T cells and B cells. And excretion, it is always done to your kidney part through the form of urine. Sometimes it may be done with the bile also in the form of feces, but always it is done in the form of kidneys, whether it is being excreted in the form of urine. And we know that the metabolism is always done with liver, and here site 4-3 is one which is used for the metabolism, and here the metabolites is done in liver. So these are the 4 words which can be represented in PK, nothing but the pharmacokinetics, and this is called as PD, nothing but pharmacodynamics. So where it is acting, and here it is representing your PK, nothing but the 4 parameters which are present in PK, nothing but the kinetics, what is called as absorption, distribution, E stands for excretion, and M stands for metabolism. So if it is new for the students, you can understand like this, but in a further classes when we go on telling about this mechanism of actions, you will be getting used to all those words, but whoever knows these words, they will be quite and easy for them. But whoever are doing these classes for the early places, it will be little bit confusion part, but it is not at all a confusion part. We can finish off with it. The class, that confusion can be eradicated in further more classes what I am doing before class, after that, after many classes, because you have to get used to all these terms. And now let us call as PK. As I told you, these are the 4 parameters which consists of A, D, E and M, which consists of absorption, distribution, excretion and metabolism. Absorption, I told you already, it has been absorbed by the oral route and has to be given 15 days before the surgery of your organ transplantation. And we know that it has to be distributed particularly to your T cells and the B cells, and also the lymph nodes, which are being the storage house of all these T cells and B cells, and so it is distribution particularly to your T cells and B cells. And excretion, we know that it is done by the kidneys. And for the metabolism, it is done by, we know that different types of metabolism techniques will be there: oxidations, reductions, glycosylation, gluconerization, phosphorylation. So different types of techniques of metabolism, and we know that it is called as CYP43, which is one of the enzyme which is being done released by the liver for the metabolism of your various drugs to release of your toxicity. So this is called as PK. And next we will go for the ADRs and side effects. We know that ADR stands for adverse drug reactions and side effect stands for SE. So here there are different types of side effects in ADRs which are used by as a, whenever we have to use this immunosuppressants more and more in quantity, and we need to, and here I want to just highlight one more point over here. As I said here, the absorption is done before 15 days, but after the surgery also it has to be given for the patient, so that the foreign organ part of foreign body organ will be collected and detected by the body. And after that also the 15 days more surgery, 15 days after is also given through IV. So these are the 2 points over here. I just want to add up out here. So here what can I want to tell you one just again. It is absorbed by the oral route, which is given 15 days before the surgery, and it is also given to the patients after the surgery for 15 days, but it is through IV route. So IV route is another route which has been absorbed through the venous route, which is a very fast technique of parenteral technique of absorption, and the oral route. So before the surgery given, it is given in the form of oral route, and after the surgery it is given in the form of IV route. And also we know that the representing the other things are the same. Here D is done with the C cells and B cells, and E is with the kidneys, and with the cyclosporin is particularly onto the liver. And here I am representing you the ADRs and the SEs. We know that ADRs are nothing but the adverse drug reactions and the side effects. And so ADRs we get much and more. It's called as lethargy. This is one of the ADRs which can be done. And also we have hyperkalemia, nothing but increasing of potassium inside the body. Hirsutism, this is one of the hirsutism. You may be confusing what is hirsutism. Hirsutism is nothing but the growing of hair onto the face and onto the body, the all over the body in more and more quantity. Particularly this is seen in women more. This is called as hirsutism. You have hyperkalemia, you have lethargy, you have tremors, you have seizures, you have hypersensitivity infections, infections of the skin, and also you can see gum hyperplasia. Gums are nothing but your teeth part. Hyperplasia means swelling. So these are the different side effects and the ADRs which are being caused by the cyclosporin whenever they are used in higher quantity, and whether they are used in unlimited form, whether it is do it after 15 days or it actually the course is between 15 to 15. So 15 before and 15 after the organ transplantation. If at all it has to be continued for some more days and the patient may not be maybe corresponding to the for that foreign organ organ transplantations in much higher rate, he has to give the course much more time. So whenever the conditions of more prolonged use of immunosuppressants are being used, and these are the little bit side effects which are being observed by the patient whenever they have been. So one that is called as lethargy. I'm sorry, I have to give it as GY here, lethargy. And you have hyperkalemia, nothing but hyperpotassium, nothing but more and more potassium. Hirsutism, it is nothing but the abnormal hair growth onto the face and the body, particularly it is seen in women. And it is also actually it is seen in anyone, but more and more it has been probable for the women. And it is born for the tremors, it has to be born for the seizures and some infections called as hypersensitivity reactions. And you have gum hyperplasia, nothing but the gum swollen. We know that hyperplasia is nothing but the abnormal growth over there. That is called as hyperplasia. Here gum hyperplasia means something abnormal growth onto the gums which are been attached to the teeth. The teeth and the gums both are the same category. So these are the different side effects which can be seen over here. What is called ADRs and the side effects. And now we'll go to the next category. What is called IR. We know that IR will always stands with interactions, through which drug it has to be given, to which drug it is not to be given. So here the some classifications, some categories are given. I am representing over here. I am representing cyclosporin as so C for here. So you don't confuse yourself. C stands for cyclosporin. Cyclosporin along with potassium sparing diuretics. We know that the best example of potassium sparing diuretics is, can you guess what it is? It is nothing but spironolactone. And so the cyclosporine, when it is given with the spirolactone, actually we saw this as having hyperkalemia, but if at all it is being used in potassium sparing diuretics, the more and more potassium will be increased, so you can get more and more hyperkalemia. So the patients who are using diuretics along with the spirolactone should not be given the immunosuppressant. So the combination should not be worked out. So it is called as interactions. The interaction between the cyclosporine and the sparing potassium diuretic is not so workable. Why? Because it is much more increasing your potassium. Why? Because it is already having a side effect of potassium, increasing of potassium. So this is the first one, and I am going to the next one. It is called as a metabolic inducers. And what that metabolic inducers are: ketoconazole, erythromycin, vancomycin or vancomycin, so these are called as metabolic inducers. And this ketoconazole is nothing but antifungal category, erythromycin is an antibiotic, and vancomycin also an antibiotic. So these are all three commonly called as metabolic inducers. So whenever these type of metabolic inducers are given, you are always having the higher metabolic rate. So this combination is not workable. It is increasing your metabolism and increasing your bioavailability of the drug. And particularly it is increasing your toxicity. Why? Because it has been circulating inside the body when metabolism is not being done, and the metabolism is increased in much rate. So here the cyclosporine cannot be interacted with all these three parts. What is called ketoconazole, which is nothing but an antifungal part, erythromycin, which is an antibiotic, vancomycin is an antibiotic, and so all these three categories will come under the metabolic inducers, where it is trying to increase more and more metabolism. Once this more and metabolism is being increased, you know that the bioavailability of also will be more and more increased, and he wants to get more and more drug dosage inside the body. So once more and more inside the drug has to be given, the toxicity will always be produced. So these two categories can be taken into consideration into the IRs. So this is called interactions. And finally we'll go to the contraindications. We know that CI stands for contraindications, and we know that these type of drugs cannot be given for the pregnant women, and these are also cannot be given for the patients who are always using diuretics, particularly spironolactone. This is much indicated, contraindicated, and it is also being used in the who are been using barbiturates, phenytoins, and so these are also cannot be used. The patients with CNS drugs. Patients. Why? Because it leads to enzyme induction, and so enzymes will be taken. So we get tremors and seizures. Why? Because it is one of your side effects, so it cannot be used in your in this prescription. So it is called as CI, nothing but called as contraindications. This is called as pregnant women. One is called diuretics, and other one is the patients who are using barbiturates, phenytoins, warfarin, anticoagulants, the barbiturates, benzodiazepines. So these cannot be connected with these two drugs. So it is called as CI. And now we'll come to the final part, what is called as brand name, and what it is available in the market, in the what name it is indicated. We know that the cyclosporine is a chemical constituent which consists of the chemical AC, nothing but the active constituent, but it is not available same as in the market, but it has to be taken in some of the other forms called as brand name, which is produced by different types of drug companies. And so that brand name which is available in the market is called as Immusin. which is available in the form of oral tablets, IVs, nothing but the parenteral forms, in the dosage of. Next category goes for the dose. How much we need to take for one patient? It is given in the form of 15 milligrams per kg per day. So this is the best dosage form is to be given for the patients. How much we need to give? We need to give at the form of 15 milligrams per kg per day. That means for the one day, for the whole day, the 15 milligrams has to be distributed. Whether it is done in 2 times, we need to divide this dose into 2 times, and whether it is to be done, that means the 50 milligrams per kg means how much the body weight of a person will be there. So it is given as 15 milligrams per kg body weight. So this is the dosage form. It is available in the form of oral tablets. Particularly I told you the oral tablets is given before the surgery for 15 days prior the operation, prior the transplantation operations, and also it is given in the form of IV after the organ transplantation. That means after the surgery for 15 days, so that the dosage will be maintained until the body will be connected to that organ what has been transplanted by the surgery, and that is given in the form of dose for 15 milligrams per kg per body weight. So this is the whole picture of the cyclosporin, and from the cyclosporin we saw the mechanism of action, we saw the PK, nothing but your pharmacokinetics, we saw ADRs and SE, we saw IR, nothing but interactions, and we are seeing about CI, nothing but the contraindications, and we are seeing the brand name which is available in the market in the form of Immusin, which is available in the market in the form of oral tablets, and the IV, nothing but the parenteral forms, and the dosage is given in the form of 15 milligrams per kg per body weight. And here this has to be remembered by a pharmacist. Why? Because the pharmacist has to be get aware all the dosage forms which are available, and also he has to know the brand names which are available in the market, so that the pharmacist will be much aware of all these compounds which are available, and so that he may suggest or he may prescribe this type of drugs to the patients, or he may give you the awareness for the patient what type of drugs you are using and for what intention they are using. So the pharmacist should be always aware of himself, so that the whole picture of your cyclosporin will be coming into the picture. So this is the end of cyclosporin, and also it is the end of immunosuppressants, where we did from the first immune definition. Later we saw how the immunity has been distributed all over the body. We saw the mechanism of action, we saw the classification, and we saw the potent drug what is called as cyclosporin, particularly into the calcineurin inhibitors. So this is the whole of your immunosuppressants, and now we'll go for the next immunomodulators in the next class. Thank you for taking these classes. Bye.